There's this big global conflict these days, human welfare and the impact of AI.
Innovation for me is not a shiny object. Innovation for the sake of innovation is never going to work.
There cannot be a replacement according to you.
The innovate will never become a robot unless until the person at the center requires a robot. There cannot be a replacement
To
for the
that
human
human
touch.
touch. Hello and welcome to this special conversation. With me today, very special guest, Rohit Agarwal, Senior Vice President and Head Transformation, Innovation and Enablement at Optum Global. A great pleasure for us to be welcoming you here in this special conversation on AIM in partnership with Optum.
Thank you. Great to be here.
So Rohit, let me first begin by asking you, it's a pretty long designation, if I may say so. Right?
Yeah.
I mean, innovation, transformation. So let's talk about that.
Sure.
Just help me understand. How do you look at the word innovation and how does it lead to transformation?
Yeah, no, so it's a long phrase because what we've tried to do, we've tried to use words that people can relate to, right? That people can imbibe and then be a part of the culture that we're trying to drive. Innovation for me is not a shiny object or one big thing that will happen suddenly overnight. It's about making persistent changes step by step. It's like a journey that you have to be on. For me, it's challenging the status quo, right? And converting that into actions and pulling it through to the value that we're able to generate. So you think about innovation, it could be, from small ideas, incremental changes that you need to do on a day-on-day basis that get you to somewhere. It improves the work that somebody does, or it, helps improve, just a little bit of an experience, or big, massive changes that can happen that really transform the way you do things. You create new solutions, you create new products. So innovation is a mix of both the small and the big, and I think that is why it's so important. So I'm part of an healthcare company, and for me, when you think about innovation, it translates into the changes that you're making in the lives of the people that we are privileged to serve, right? I mean, how do we make sure that healthcare becomes better for everyone that we serve? We were speaking earlier about data, right? I think one of the things that we need to understand is that behind the data, behind the work that we do, there is a human. Behind every claim, there's a human being. Behind every call, there's a human being. So for me, when I think about innovation, it's not about, process maps. It's not about the tools, but it's about the humans that we serve.
I mean, it's a good phrase, about the humans that we serve. So let me just delve a little deeper into this with you. Your company primarily caters to the American markets.
Yeah.
So let's say the human lives. How does Optum cater to a human life?
Yeah. So I think the purpose of our company is to make sure that we're making the health system work better for everyone, right? So why does anybody take insurance? They're doing that to make sure that they're able to not have a financial burden when they go through some episode in their lives, right? And what we try to do at Optum is making sure that we are able to leverage data. And I'll give you some example, right? Data from wearables, right? You wear Apple watches. Pull in that data. You pull in data from social determinants of health. You pull in data from your electronic health records, past visits, your entire medical history. And then you're able to identify population that can potentially be at risk. And then you're able to really proactively reach out to them and prevent issues from happening, right?
So it's like an end-to-end solution that you provide.
It's an end-to-end solution, which is thinking about the whole health care of a person. It's trying to prevent issues. It's if the issues happen, it's trying to make sure that the quality of care that we deliver is of utmost quality, is affordable, and creates an experience for the members that we serve. So,
And is there like an age barrier or age threshold where you start? I mean, from the time, let's say a child is born,
Yep.
right, till the time, let's say life expectancy is 75, 80. Like I'll give you the Indian context, right? I mean, in India, it's difficult to get a health insurance for a senior citizen,
Yep.
right? I mean, in these spaces, what kind of solutions does a company like yours really offer?
So the Indian healthcare system and the US healthcare system are very different, right? And I think in the US healthcare system, the system is one very robust. The good part is, this is not restricted to any urban setting. It reaches out to both urban as well as rural setting. So that is why, to your question, it's an end-to-end coverage of the US healthcare population.
A short while back, you said that one of the principal ideals for you in your definition of innovation is challenge the status quo.
Yep.
Help me understand this. How does someone like you, with your experience, you've done over 11 years at this company now,
Yep.
you have rich experience in the field, how do you challenge the status quo in your process of innovation?
Yeah, no, so great question, right? So, see, for us, innovation isn't about a team. It's not just my team that is driving innovation. It's a system. It's a way of thinking. It's a culture. And, we are very, very conscious about that. And we've got various programs and initiatives that drive that, right? So our innovation framework and program is called Innovate. It's a play on words. The weight, the last part is the number 8, which has got 8 pillars of that entire framework. But what it does is it is able to pull in insights from our frontline employees, from our leaders. It's able to couple that with technology, with data. It's able to align all of those issues with priorities and create solutions that are scalable and well as ones that are reliable over a period of time, sustainable over a period of time. So that's one thing that we do. For us, like I said, culture is very important. So when you think about culture, we've got programs where we are asking the frontline employees to come up with the ideas, and that is very critical.
Can you give me an example?
Yeah,
How does it play out in real life?
Yeah, so we've got a program called Bright Ideas, right? Where any associate, any frontline employee that's, let's say, processing claims, they're the people that have the best view of our workflows. They're the people that have the best view of the experience of the members and providers. So they come up with their ideas. They share them with their managers. What we've done is we've created an environment where people have that psychological safety that even if I'm a frontline employee, it's okay for me to share an idea to make things better. That idea may not be an idea that may get implemented, but I feel comfortable in really driving that idea and coming up with that idea. So we've created those platforms where people can give those ideas, and then we support them through mentorship, through guidance, through technology, so that that idea can get implemented.
I'm thinking about what you're saying, and what really comes to my mind is that maybe companies or entities who believe in scalability.
Yep.
Would I be wrong if I was to say that the first step towards scalability is a psychological safety that you speak about? If there's no psychological safety of employees, how are you going to scale up?
No, absolutely.
Would that be the right way to look at it?
No, it's absolutely right? Because, see, innovation starts with an idea, and then you have to convert that idea into, you have to test out that idea, right? You have to experiment, right? And if you're not creating that safety, if you're not allowing people to experiment, fail, right? You will never be able to get ideas.
How do you deal with failure?
And failure is important, but you have to fail fast and learn fast.
It's not fail fast and learn fast.
Yeah, it's not okay.
That's a new one that I've heard.
It's not okay to only keep failing, right? With every failure, you have to be able to learn what went well, what did not go well, so that you're able to involve that, imbibe that into your next step. So I agree, right? I mean, that psychological safety is very important. And then you also need to create an environment and an ecosystem which is helping people really innovate, right? So if I've got an idea, I should know what needs to be done. I should be able to understand the various parameters that are required, the tools, the technologies, the elements that will come together to be able to drive innovation.
So let's say I'm an employee of Optum and you're my reporting manager, and I come to you with a great idea. Help me understand this chart. From the time that I approach you as my senior manager with my ideation, how does it lead to scalability of the business itself?
So that idea will get evaluated against, a typical North Star, right? And if you think about a company like ours, our North Star is creating a better experience for our consumers, better affordability, better quality of care, and better cost, right? So every idea is matched against that. And then what do we do is, and we've seen great success in that. We've got co-located teams. We've got co-located product teams, technology teams, operating teams, and operational excellence teams. And these are the teams that are actually helping break the silos. These are the teams that are actually able to create solutions that we're able to then get to the market in a very accelerated manner, right? So, just think about that, if all of them are coming together to understand the problem that you've identified, right? You're getting a diverse set of views, and you're also getting the expertise that is required, both from a domain as well as product as technology, to be able to create that solution quickly. And then because the product people are so closely aligned to the market, to the consumers, they're able to then scale them in a very rapid way. So that really helps us, drive the scalability across the organization.
Yeah, a lot of what I hear these days, particularly in the kind of spaces that your company operates in, there's this big global conflict these days which is on between human welfare and the impact of AI.
Yep.
All right. Now, you've used a very interesting term, psychological safety.
Yep.
Right. Let's look at human welfare. The impact of AI through the prism of psychological safety. Is greater advent, greater usage of AI, in your opinion, is it detrimental to human psychology? Is it detrimental to what we may typically describe as human welfareism?
So if you think about usage of AI, I think we are very clear that we are very responsible in the way we use AI, right? Which means that making sure that we've got the right transparency in the usage of AI. And as we invent and as we innovate, we're very clear that we keep the human in the center of everything we do. So whether it's AI, whether it's technology, whether it's a process change, it'll all be centered around the consumer. It'll all be centered around the patient, right? So think about technology and AI and the people. We never start with the technology. We never start with AI. We start with the person at the center.
So innovate will never become a robot.
Innovate will never become a robot unless until the person at the center requires a robot to do a work, right? So that human-centered design thinking based approach is absolutely critical in this environment because it's very easy to put technology and AI and everything, but AI needs to be, like I said, responsible. AI needs to be reliable. AI needs to be able to give you similar and same responses when it's needed. And like I said, the first part of any innovation has to start by making sure that you understand the needs of the consumer. And we do that very well by putting our ear to the ground.
So you've spoken about the need for responsible AI.
Yep.
And safe AI. Help us understand this because again, these are phrases which one hears a lot,
Yep.
but how does it actually work on the ground? How does it play in action?
Yeah, so we've got a program at Optum called the Responsible AI Program, right? Which every model that we deploy, every model that we buy goes through that program. And like I said, it is important for every AI model to be, we check on fairness, we check on transparency, we check on explainability.
Who's checking? Is it AI checking on the AI or is it human checking on
This
the
is humans checking on the AI. So this responsible AI program is the one that is responsible for checking all of these AI models. It's checking to external standards. It's checking for things like biasness, things like, are we complying to the regulatory standards and compliance? And only then are we using AI across the organization. And for that, for us, it is absolutely critical. It's a go no go decision in our company.
But let me take you back to what you said a short while back. You fail fast
Yep.
and learn fast, right?
Yep.
In that kind of an environment of fail fast and learn fast, whatever you may be innovating, is the shelf life of that innovation itself also not being impacted then? Is it like lesser? If I have to fail fast and if I have to learn fast, I may have come up with the best possible idea. How do you ensure that the idea, which once, if say accepted, that innovation, that idea stays for a certain length of time? How do you ensure that?
So again, I'll go back to the point that I made that innovation for the sake of innovation is never going to work, right? Innovation has to be aligned and centered around the problem that we're trying to solve, right? And if the problem is a problem that is a problem that our large population of people are feeling and facing, it's a problem that is going to last for a while, right? So putting the consumer and the problem in the center is the best way of making sure that any solution that you are delivering on is going to be sustainable. And hey, technology is changing rapidly. So the AI models are changing rapidly. So how you solve for the problem may change, but the core of the problem and the solution that you build is going to remain the same. And it's happening everywhere, right? I mean, consumers in healthcare are changing. Their needs are changing. 10 years back, the consumer was very different. Now the consumer is so tech-enabled. They need personalization. They need convenience at the fingertip. Healthcare for them is like booking a airline ticket or their travel, right? It needs to be in the palm of the hand. So how you solve for that is being able to make sure that you're creating that convenience for our consumers. And we're using platforms like digital and AI to be able to do that.
Do you ever see your company? I mean, you right now you're servicing the American markets, but you have people all over, from what I gather. What's the uniqueness you feel about the market that you operate in? Does it make your job difficult from the point of view of you ever thinking of expanding in other markets as far as serviceability is concerned?
Yeah, I mean, I think healthcare is a global need. Healthcare is so human centric that I don't think the needs of the patients, is very different across.
They don't vary according to
They
you.
don't vary according to us, right? The way you bring these solutions to them obviously will vary, right? The geography, rural setting, urban setting, the kind of quality of care, the quality of life changes. So for us, I think making sure that we're meeting the patient where they are is the most important thing. And you need to be able to have that ecosystem to be able to create that access to care. You think about any issue that you have for yourself. What do you need, right? What you need is access to care. You need to be able to be cost effective, and you need to make sure that the quality of the care that you finally get is important. If you're able to match these three well, right, according to the needs of the patient, you've done a good job in the eyes of the patients that you're serving, as well as you've been able to make sure that you're helping people and helping overall increase the health of the economy.
But in this space, I'm listening to you and I'm thinking that
Yep.
we only hear technology about us, right? We only hear greater and greater usage of technology. And you've used a very interesting term. You're a human-centered, human-centric company.
Yeah.
I'm trying to ask myself if there's a conflict or if there's a contradiction between the two. To have a human-centered approach versus being a company or being a business which is welcoming technology with open arms. Are these complementary to each other,
Oh, they
or
are.
are they completely contrary to each other?
No, they're completely complementary to each other.
How?
Because at the end of the day, technology is really helping us scale these ideas, scale solutions. Technology is able to help make sure that the reach of the solutions that we do, that we build, are expanded. So I spoke about human in the center, right? Why is that important? I said because at the end of the day, we need to understand the problems that the patients are facing, clinicians are facing, doctors are facing, right? And then instead of building solutions one at a time, you need to be able to solve problems which are scalable across organizations, scalable across the entire industry. Um, the current environment, in healthcare is that companies are facing a lot of cost pressures. The number of diseases are increasing, right? It is more expensive. Drugs are more expensive. So there's a lot of pressure on companies, right? And I also told you that consumer expectations are changing, right? Like I said, it's more personalized. So the only way to solve for these are not through incremental changes, but through changes which are scalable and large changes. And that's the way technology is able to help. I'll give you some examples, right? So just think about access to care. You don't want to make sure that access is limited to a few individuals. So how do you expand access to care? You do that through virtual visits. You do that through telemedicine. You do that through platforms that are helping patients search for the best providers, search for diagnostic conditions and care pathways. If you think about providers, right, instead of them spending a lot of their time on doing administrative work, they're using virtual assistants. They're using real-time updates to electronic health records, and that reduces the administrative burden to them. That's all technology helping them. And what is it helping them do? That it's helping them spend most of their time in the most critical thing for them, which is spending time with the patients. Just two examples to show that technology is really helping us drive better care and quality of care for our individuals.
You're the right person to be asking this question, since you're looking at innovation and you're looking at enablement. Let's do some crystal ball gazing.
Okay.
Right? You've given me a great idea of what the last 10 years have been.
Okay.
Let me ask you, do you think there is going to be a scenario where, because of the businesses that you all are involved in and the kind of technologies that you use with your human-centric approach, will there come a time when a visit to a hospital will, in terms of sheer numbers,
Yep.
will actually get lesser than, let's say, these AI-oriented themes, telemedicines,
Yep.
etc. Will a visit to the hospital get impacted by that? In the sense that, can we think of a virtual hospital now in the immediately foreseeable future?
Yeah, I think the balance between going very virtual and that human connect will always remain in the healthcare setup, right? Because health is so personal that many a times you need that person to be able to provide you that sometimes right direction, sometimes clarity about your status. But you break it up into health conditions, right? Simple health conditions, simple problems can be easily done in a virtual setup. You don't need to visit the hospital or the provider, and that is why a lot of tele health is happening. A lot of virtual home care is actually happening. Home visits are happening and telemedicines. But as you get into more chronic diseases, as you get into more complex situations, you need that human touch. You need that clinician, provider, and patient touch to make sure that there's better diagnosis. There is a little bit of explanation of the issues, and thus better care that can be provided.
So
So
no
I would
matter-
always see a balance between them.
So there cannot be a replacement, according to you,
They cannot be a replacement
to
for the
that
human,
human
touch.
touch.
Absolutely.
Okay, Bruce Springsteen's "Human Touch" song, perhaps
Absolutely.
is a song to think of. But in conclusion, we've looked at all possible opportunities and looked at everything that's going right. But leaders like you, I'm sure, may also be thinking of what are those challenges, those critical things. Where can things go wrong? Right now, the balance is there between AI and this human touch that you're talking about, right? But in future, are there areas which you feel should be of concern to the industry, to the people?
Quite a few, right? And I think as a company, we're making sure that we focus on them proactively. I also think that the focus on experience is going to be extremely important, right? Like I said, the consumer is getting more concerned and needs that personalization. I think companies that do not focus on creating a much better experience for our members and patients will find it difficult to kind of really get up the experience curve. And then at the end of the day, personalization is absolutely critical, right? These are linked, personalization and experience. But uh, when you walk into a hospital environment or you walk into a doctor, you don't want them to give you things which is from a set decision tree or an SOP, right? You want them to personalize the diagnostic plan or the solution to your needs, right? Basis your requirements. So the more of that, thinking about that in a virtual environment and being able to blend virtual and physical together is going to be absolutely critical. Companies that do that well by leveraging data, by leveraging things like AI and the cloud are going to be really successful. Otherwise, it's not going to be that easy.
Okay, Rohit, it's been an absolute pleasure listening to you. And thank you so much for helping us identify the challenges, what's right and what's wrong. And here's wishing you and your company all the very best in future as well.
Thanks a lot. Great
Thank you.
talking to you.
Thank you so
Thank
much.
you.